We've actually tried several times already to have what we have a council agreement bill in our that is being heard in the Senate, and what that's doing is allowing pharmacists more freedom as far as being able to manage disease states. Currently in Ohio, for the way our council agreements law works, is each pharmacist, each physician, and each patient have to have an individual contract to manage whatever disease state is being asked of us. So it becomes very cumbersome when we each have to have so many different contracts for all of the patients we're managing. On top of that, we're not able to order lab tests. We're not able to start new medications, for example. We can adjust medications that are being prescribed, but that's pretty much the extent of what we're able to do. So one of the things we're trying to include in this legislation is pharmacists able to have more freedom to order those labs or to stop or start new medications within the framework of the council agreement, which would include more of a holistic sort of one practice could refer all of their patients for certain disease states to a group of pharmacists and just have one sort of overarching contract that would allow us to have a little bit more freedom to do so. And some of the opponents to the council so far have been, do pharmacists have proper training? Do they have standard training to be able to do this? Should we be allowed to make medical diagnoses, which the current bill would not allow us to do? How does the liability work? And there's a lot of questions which are fair questions, and our argument has always been, we're not trying to pull patients out of physician practices. In fact, we're trying to work alongside these physicians and nurse practitioners and other providers in order to help patients have the best care possible. And have that available within the state of Ohio, because there's several states already who have gone down this route. So I think those are the biggest opponents so far, but we've been able to work with the medical groups in the state of Ohio and across the nation. We've been able to collaborate with some other organizations in order to sort of find some common ground where we're both happy with the legislation that's going in.